Okay, my people. Yeah, so we dey talk about the predisposing factor. Make I drink water first. Uh-huh. So, my voice no for crack, abeg. Uh-huh. So we dey talk about the predisposing factors or wetin be the risk factors. So in this case, that risk factor wey we dey talk about, one of them na wetin dem dey call impaired defense mechanism. Impaired defense mechanism. It means say that thing wey the body dey use dey defend himself against infection, e don get wahala o. Okay, e don be say problem don happen to your tire, okay, or to that thing, that your protector wey you put for your window to protect against invaders. Protector don spoil o, something don happen to protector no strong again, something don happen. That be impaired host defense mechanism. Now the second one, okay, so the first one na impaired defense mechanism, then the other one na decreased host resistance. So now as the host, the resistance, the power wey dey carry dey resist something, e don go down. You understand? So before you dey do like this, but the resistance, e don go down. Now like this you dey do. Understand? Before you be Anthony Joshua, but now make I no mention the person name, sha. All right. So the two important points. Now one of them na impaired the defense mechanism, and the other one na decreased host resistance. So now make we take number one, which is impaired. Impaired defense mechanism. Now it's very important make you know say the respiratory system, okay, they constantly exposed to danger. The respiratory system, they constantly exposed to danger particularly from the environment. Why I talk like this? You see your nose, they open for outside, right? And you they breathe in. For you to be alive, you need to breathe in. So as you they breathe in everything we follow for the air within the environment. So as you they breathe them in, you they go directly into your pneuma, which is the lungs. So you can see that if you say your body, they very exposed, particularly your lungs and the respiratory system in general. Should you understand them now? So if anything happens to the defense mechanism, where they protect you against those yama thing, you don't finish with that. Pneumonia will set in. You understand the point? So now, first of all, we will discuss wetin be these defense mechanism where the body actually gets, where they prevent us from actually getting infection, for example, in the lungs, will be the topic we'll talk about today. Okay? So one of that defense mechanism, sorry, Jerry, one of the defense mechanism now cough. I catch you there. One of that defense mechanism now cough. Yes, some of you say cough na very bad thing. Cough na very bad thing. In fact, one get cough. My brother, my sister, cough is very important. Okay? Cough, particularly cough reflex, they prevent against a lot of things. And in this case, na very good defense mechanism. But anything where fit obstruct this reflex, this particular cough, to actually from happening, it is very dangerous. Okay? So if anything where fit stop you from when it is necessary, not be the one where they unnecessary, where they caused by some diseases, but the preventive one, okay, where they help you to bring out things where no they needed. Anything where prevent them from happening go lead to accumulation of microorganisms for your lungs, and go lead to infection, which will lead to this disease what we talk about. Okay? So now let us make we list some of the things where they prevent this reflex from happening. And unfortunately, one of them, now when the person they unconscious. For example, in the state of coma. So if, for example, person get accident, sorry to say, and then the person come dey for coma, a comatose situation. When you talk about coma, now when the person, they feel anything again, okay? The functional organs, some of them they work, so they protect the person, but for the brain and every other place, they down. So the person don't know anything when they happen again, okay? They like, but not be the same thing. They like when person faint. Understand? Because I know so I can understand that one. Yeah. So when person they in state of coma, the person they completely unconscious. Okay? So in that case, it will actually they impede on the cough reflex. Because in that case, nothing they work. The muscles where they help you cough, nothing they happen. And that will lead to aspiration. Now, what be aspiration? Aspiration means say the food or any content within your stomach will come move back into your mouth, and it will come pass through this hole. You get one hole where they inside your mouth, where the epiglottis they cover. It will come pass through that pharyngeal space, pass through your trachea, then pass through that trachea, then it go directly into your lungs. Okay? And when that thing don't happen, infection with that go don't start. And like that, infection they start. So that one now one of them. Now the second point where it lead to this particular condition where we talk about, where it impede on this reflex, this particular defense mechanism, that one anesthesia. So you see when patient go hospital, for example, and the doctors and surgeons want to do very, very huge medical procedure on the person. Maybe they want to do laparotomy. Laparotomy is a surgery where they go open, this your abdominal region to foresee everything and do proper, medical procedure inside the particular area where they need. In such situations where you're there under anesthesia, aspiration still occur. And if aspiration occur in that case, it could still lead to exactly the thing what we talk about again. It could lead to pneumonia. Now the next point, where it still cause this particular thing, now medications. You get some drugs where people they take, understand? Medicine where people they take, where it cause also the impede them, where it stop the cough reflex. And anything we do it will lead to aspiration, and if it cause as well this infection. So if you see say anything at all where they involved, where they stop that particular defense mechanism, it will cause pneumonia. So these points where I don't give you, now some of the points, they're very, very important. Make you take note. Say, instead of unconsciousness, like coma, anesthesia, for example, medications, understand? These things will impair that particular cough reflex. Even, for example, some neurological conditions, they're very, very important. Some neurological conditions where they weaken the muscles, particularly where they in that region, will also cause infection. Because when the muscles in that region where they help, where they help you for bring out the expectorate, where they need cleanse the lungs, if those things not there again, what thing will happen? These things go still deposit for there. This yama we need to come up for the lungs go still deposit for there, and it will come to build a lot of things again. Understand? So it is very, very important. Make we take care of these things. Now the next point under impaired host defense mechanism, Now, problem with the mucociliary apparatus. Mucociliary apparatus. So we'll go discuss that mucociliary apparatus in the next slide. So I want to see you for the next slide. Don't go anywhere. See you.